Well, the list of things that we might want to keep around post-pandemic could include anything from staying at home when you're sick or wearing a mask when you're sick. More people working from home is a positive. And virtual healthcare. In fact, a new survey reveals that this is something that Canadians like. Dr. Richard Tytus is an associate clinical professor at the Department of Family Medicine at McMaster University, is also on the National Virtual Medicine Task Force, and a co-founder of Banty Incorporated, providing video conferencing for virtual healthcare. Dr. Tytus joining us this morning. Thank you so much for your time, Dr. Tytus.
My pleasure.
So, as I mentioned off the top, this is something that Canadians seem to like, the expanded availability of virtual healthcare. This new study from Optum. What specifically did Canadians say they enjoyed? What did this survey say, Dr. Tytus?
Well, in particular, with Canadians during COVID, we have to shift. We have to go from office visits to virtual visits, from phone visits to video visits. And what Canadians found was they enjoyed this interaction. They found it more convenient. They could get access doctors better, easier. They didn't have to leave their home. They weren't exposed to any diseases. And at the end of the day, it was very convenient, and they were able to access health care in their privacy of their own home or their car, wherever they felt comfortable. And Canadians have told us, yeah, we want to continue this at the end of the pandemic.
Yeah, what is the future? Because as you said, this is something that we had to do. We needed to pivot to keep each other safe. But is this the future of medicine?
Yes, absolutely. So more recently, the government and the Ontario Medical Association have recently come up with the PSA, Physician Services Agreement, and doctors voted. I think the vote was in yesterday. I'm not sure what the results are. But at that time, the government and the OMA have come up with the agreement and to promote virtual medicine even further moving forward. Virtual medicine, online booking, just to make it more convenient for patients to access health care and to access health care when and how it's convenient for them.
Could this come with a double-edged sword, though, Dr. Tytus? I mean, I'm thinking specifically of remote communities who may have less access to healthcare, so this would be a great way to fill that gap. But it would also then not necessarily require a doctor to be physically in any of those communities ever. So could it mean, by extension, you actually get less in-person representation of doctors in some of these communities?
Well, virtual medicine has shown to be very impactful, very effective. And also virtual medicine has different layers of technology. So potentially, when the virtual medicine can also have digital tools. So, for example, you could be in London and you could have a patient that's in Moose Factory, and with digital tools, so you can have electronic stethoscope, electronic otoscope, so you can do a whole fulsome exam regardless where you are in Canada.
As with anything virtual, privacy is obviously a concern, but when it comes to your health information, this is something that we are particularly sensitive about. As I mentioned off the top, you are a co-founder of a company that does provide this service, Banty Incorporated. As a platform, is that a main concern, the privacy of our health information?
Yeah, health information is crucial when it comes to privacy. So the virtual platform you use, it can't be, it has to be something that is geared towards virtual medicine. It's got to be PIPA approved in Ontario. It has to be verified and validated by Ontario Health. So again, we take privacy as crucial when it comes to delivery of medicine. And And we also tell our patients, you have to be in a private location when you're speaking with your doctor.
Absolutely. Yeah. Privacy is everyone's job, including our own. Well, Dr. Tytus, it's a fascinating conversation. Thank you so much for giving us your time this morning.
My pleasure. And if you want to see your doctor, you could see your doctor in the privacy of your own home. This is the new way of medicine.
Absolutely. Thanks again. Have a wonderful day.
Thanks. Bye.
Bye-bye. That is Dr. Richard Tytus. He is a co-founder of, as I mentioned, Banty Incorporated, and is also on the National Virtual Medicine Task Force. It is 7:28. Got Alessio Danini in your 7:30 news next.